Okay, this is where we're going to pick back up to finish the part C. I know these are some very long presentations. Chapter 12 is very in-depth. This particular presentation itself is 82 slides long. We're going to leave off with protection of the brain. And when we think of protection of the brain, we need to be thinking about the meninges. And the meninges is going to have three parts, and that's what I'm going to be asking you about. These three parts are the dura mater, arachnoid mater, dura mater, not matter, M-A-M-A-T-T-E-R. I said matter, not that. So dura mater, arachnoid mater, pia mater, right? So these are the three components of the meninges, and their function is for the protection of the CNS, also for the protection of blood vessels, contain the CSF, and they also form portions as well. So here we can see our dura mater, the arachnoid mater, and the pia mater. So these all provide a form of protection. So we said we are talking about the meninges. So then look at this term here, meningitis, inflammation of meninges, right? So it could, depending if the individual does not seek medical treatment, it could spread throughout the central nervous system, which would result in inflammation of the brain, referred to as encephalitis. Encephalitis, swelling of the brain. So I believe I've just talked about this briefly with you before. Meningitis, you have to get a sample from the cerebrospinal fluid in order to accurately diagnose whether an individual has meningitis or not. Difficult to diagnose visually. Sometimes there's stiffness of the neck, headaches, even flu-like symptoms. So it's a tough one to diagnose. Again, we know what the cerebrospinal fluid is, forms a liquid cushion of constant volume around brain. So we've talked quite a bit already about cerebrospinal fluid. So let's take a look at hydrocephalus. So what this is you have a blockage of the cerebrospinal fluid to circulate and or drain. What does this do? If you have a blockage and it prevents the circulation and or drainage, it's going to increase pressure. So in the case of newborns, their skull bones are not fully fused, and as a result, the usually top and back part of head can expand. In adults, since the skull is fully formed, it cannot expand, and as a result, you're going to have increased pressure, leading to brain damage because it can compress blood vessels, and it could crush the soft nervous tissue. So you have to drain the cerebral spinal fluid in order to reduce this pressure. This is an example of hydrocephalus in a newborn. So clearly the adult brain cannot expand like that. So this is actually, in a way, a good thing that it can expand. It's going to decrease some of the pressure. The adult brain will quickly gain pressure because of the inability to expand. Let's talk about blood-brain barrier, because this is another form of protection, right? And that's what we're talking about, protections for the brain. So this blood-brain barrier, it has very tight junctions. It is going to prevent a lot of things from entering into the brain. So, however, it's a great protective barrier, but it cannot protect against everything. Okay, it does a pretty good job for most things, but it cannot prevent all bad things from passing the blood-brain barrier. There are different ways in which substances can enter or pass the blood-brain barrier. It can be done by simple diffusion or specific transport mechanisms. So these are some of the ways in which substances move past the blood-brain barrier. Now, I mentioned tight junctions, and that's very important for the blood-brain barrier. This is what differentiates the blood-brain barrier capillaries from other non-blood-brain barrier capillaries. If you look here, you can see these small gaps. There's going to be a gap here. There's a gap here. Here, this astrocyte has created very tight junctions between the endothelial cells. So this is the key feature of this protective structure. Very tight junctions. And look at this. We've taken a look at astrocytes before. This is your astrocyte right here. Now, it can contain some enzymes that destroy certain chemicals that would activate brain neurons. So it does have that capability, but mainly more than enzymes, it's a barrier in terms of these tight junctions, right? So that's the main story behind blood-brain barrier. Something that can pass the blood-brain barrier that just comes to mind is lead. Lead can pass blood-brain barrier. That's come in things like lead paint. You know, shouldn't be using lead paint. It's kind of hard to find these days. Lead in water. That's why we have certain state and federal regulations in terms of lead in water. If you read up about lead in water, you may come across a story about Flint, Michigan, where the large percent of the community was being exposed to lead in the water. I'm not going to go into the story in great detail, but lead is very dangerous for the developing brain. Young children are more at risk of to lead neurological toxicity versus adults. So be conscious of that. You know, some of the ways in which someone may be exposed to lead could be through lead pipes in your homes. An older home will most likely have lead pipes unless they've been replaced with PVC pipe. So it's very important to note that lead does pass through the blood-brain barrier. Let's talk about some brain injuries and disorders. All right, so here are some traumatic brain injuries: concussion, temporal alteration of function, contusion, permanent damage, subdural. We could have pressure from blood may force brain stem through foramen magnum, resulting in death. Cerebral edema, anything with edema, swelling, so swelling of brain. This is due to some sort of traumatic head injury. Ischemia. This is what happens when tissue is deprived of a blood supply. We need blood. It is the lifeline, literally. So this would result in death to brain tissue. Hemiplegia, this is paralysis one side or sensory and speech. So we have other types of cerebrovascular accidents. So paralysis to one side. These could be referred to as strokes. So when we hear about a stroke, we're talking about ischemia or hemiplegia. Alzheimer's disease. This is a neuro, right, degenerative disease. Usually results in dementia. Why? Well, there are certain key proteins that misfold and malfunction. Remember what proteins are. Proteins are enzymes. And these proteins have a specific structure. And because of their specific structure, you have a specific function. If these key proteins begin to misfold, you will no longer conduct the same function. As a result, you will have a malfunction. So we see memory loss, shortness of attention span, disorientation. Sometimes there's certain speech pathology is decreased. So you can have plaques of the beta amyloid peptides form in the brain. If you look at a brain of a normal functioning brain of an individual approximately the same age compared to an individual's Alzheimer's, you can see lack of activity and also significant reduction in brain size. For example, here, we can see brain activity in this healthy brain, looking pretty good. And then we have the brain of an Alzheimer patient. We can clearly note that there is less activity. And we could also see reduction in size occurring along the brain. And that is not a good thing. Parkinson's disease, again, this is another neurodegenerative disease. So let's go back. Alzheimer's, degenerative disease. Parkinson's, degenerative disease. Misfolding of proteins, usually resulting in some form of dementia. Here, there is a degeneration of dopamine-releasing neurons of the substantia nigra. So there is just a lack of, there you see this lack of dopamine. If you have these dopamine releasing neurons and they're degenerating, well, you're not going to have enough dopamine. So this is one of the results in terms of Parkinson's disease. Huntington's disease. This is genetic, largely genetic. So it's fatal hereditary disorder caused by accumulation of protein. Huntington in brain cells. So Huntington's disease has a protein issue. Alzheimer's has a protein issue. Parkinson's has a dopamine issue. So diagnostics. for assessing central nervous system dysfunction or dysfunctions. You could do the simple test that includes the knee-jerk reflex. That's a good one. Basic, simple. You can get some information from that. But of course, we're going to want to go a little bit more analytical. And we're going to look at a CT, MRI, or PET scan. Remember what those stand for, okay? Also remember the definitions I gave you in terms of the lesion. We already talked about radio tracers and how that works. So these are our diagnostics. And that is the end of this presentation. So I'm going to save it. I'm going to do a stop share, and we're going to end it with that. And I hope everybody has a wonderful day, and I wish you guys all the best. Thank you for watching this lecture.